A lot of people come into my office with a concern about the bump on the side of the foot. This is the area that I'm showing you on this particular model. It could be a bump on the first metatarsal joint, which is the big toe joint. It could be actually on the opposite side over here on the fifth metatarsal joint. And what that is, something that we call a bunion. And people are concerned because they've never had it before. If they've had it before, it never hurt them. And they're concerned about what it is and what we could do to help them. Well, the first thing, as I mentioned always in my previous videos, was that we need to diagnose it properly. And what that means to you is that we need to take an x-ray to see if it's actually coming from the bone. We need to sometimes do an ultrasound to see if it's coming from one of the ligaments or muscles. Once we've accurately diagnosed, we can actually formulate a very nice treatment plan. And what that means is the following. If we have a young person or a person who just started, many times it comes from the way they're walking. That means their foot falls inside. They put extra pressure on the inside of the arch and on the big toe joint. That over time forces it and puts pressure on the area. Yes, it could even sometimes happen from wearing a tight new shoe, but most of the time it comes from the way people are walking. By evaluating how people are walking, how they're standing, in many instances we can help the person by making something called an orthotic. It's a special type of support that lifts up the arch, that lifts up the bone, gets pressure off the area, and actually that causes the pain to go away because you're not putting any pressure on the area. However, there are people where it's a little bit more advanced, and on x-ray I'll show you that the bone is actually sticking out a little bit more than normal. Sometimes they develop what we call bone spurs, or little bits of arthritis in the joint, or actually little even bone cysts, which are actually holes in the bone. If we see, again, it's a beginning problem and support is the right answer, that's what we would direct you to have and make and do. If, however, it's a shoe issue, we could recommend you the right shoe. However, certain circumstances require that we do something a little bit more. In people that it is really severely damaged, we can recommend a surgical procedure. And there are different types of surgeries, and I'm sure you've heard about it from your friends, the different types of procedures. It all depends really on the type of bunion that you have. When you come into my treatment room, I'll do the right thing, as I mentioned before, whether it's an x-ray or an ultrasound. I'll explain the problem to you and how we can help you. It may be something as simple as an orthotic, it may be a shoe, it may be a simple correction that can be done very easily in our office, or sometimes it needs to be a hospital procedure. So please, if you have this concern, don't be afraid, ask me, I'll evaluate it, I'll tell you what we can do to help you.